A new study suggests that daily low-dose aspirin does not prevent strokes in healthy older adults aged 70 and older, and it actually increases their risk of brain bleeding after falls or head injuries. The combination of bleeding in the brain and on the surface of the brain outweighed any potential benefit in reducing ischemic stroke. The study used data from the aspirin in reducing events in the elderly study, which involved about 19,000 initially healthy older adults recruited between 2010 and 2014. The average age of participants was 74, with 56% being female. The study found no statistically significant difference in the incidence of ischemic stroke between the aspirin and placebo groups. The number of brain bleeds was small, occurring in 59 people taking aspirin and 41 people taking placebo. However, bleeding events were 38% higher in those who took aspirin. The risk of brain bleeding outweighed any potential benefit in reducing strokes, including bleeds into the brain and bleeds on the brain surface, commonly associated with head trauma. Another study, published in the Annals of Internal Medicine, found that people taking a low-dose daily aspirin may be at an increased risk for anemia due to hidden blood loss. In older people who have had a previous heart attack, coronary revascularization procedure, like a stent or a bypass surgery or stroke, secondary prevention, it is believed that aspirin provides greater benefits and that reduced repeat events outweigh a concern about hemorrhage. The U.S. Preventive Services Task Force, USPSTF, recommended against starting low-dose aspirin for primary prevention of cardiovascular disease in people 60 or older in 2022, based on evidence showing the risk of potentially fatal internal bleeding that can result from regular aspirin use may be greater than the preventative benefits. If your doctor has told you to take a daily low-dose aspirin, it is best not to stop taking it. If you're unsure if you should be taking low-dose aspirin or if you're taking it for primary or secondary prevention, discuss it with your doctor.